Guess what we're doing today? Phenol Peel. You get to witness what this is like. We're going to demystify it for you today. I'm Dr. Bushore, board certified dermatologist based here in Austin, Texas at Balcones Dermatology and Aesthetics. First, we're going to start with doing some numbing injections. These are what are called dental blocks. So go inside the mouth and we numb up in here, and we do injections down here. We'll numb up the whole area around the mouth before we do the peel so it can hurt less and make it a lot more comfortable. So I'm just going to mark the areas that we're going to mostly focus on treating right around the mouth. That's the main area we need to focus on. But I am going to try and capture a little bit just outside here, and we'll do what I call like feathering, and just to kind of blend things a little bit here. And smile real big from there. See. Okay. And so that's from here to here is not going to be peeled as hard. I'm going to soften that up, but we do want to peel. This is the main area that we're concerned about, this upper lip. That's number one. So we're going to try and fix that first. Yes. Good. So now we're going to do the numbing injections. So go ahead and open your mouth for me a little bit. Good. Right up in here.
I didn't feel a thing.
You didn't? Okay, good. So this is the most important part. We want to clean it real good because that allows that chemical peel to go in and penetrate evenly. So we're just going to clean this with Hibiclens. This is just a strong soap. Make sure that skin's really good and clean. And now we'll do the chemical peel, and I'm going to start with the lips first. Get that part done. Good. And then just open your mouth a little bit. There we go. Just do the upper lip here first. You feel that burn. You okay?
I don't feel it.
Oh. Numbing medicine's working really well then. That looks great. Get the other side of the upper lip. So there's three parts to the chemical peel: is the strength of the peel that you're putting on, how saturated this is, and then the friction, how hard you rub it. So it looks even all the way across the upper lip. Now we'll work on the lower lip. You doing okay?
Mm-hmm.
So that white frost is what we're looking for. Lets me know that we're in the right spot, right place, get a good result. All right, now we're going to work on the upper lip, our main concern. There may be some areas that the numbing medicine didn't work on, we'll see. But again, if you do feel it, it'll burn for about 15 seconds and then it should stop.
Yeah, I can feel the outer edge.
Certain areas, yeah.
Sides of my lip, but nothing terrible.
And this we want almost a grayish color. So then we know we got deep enough to fix those. So more than just a white. And for a little bit of a gray here. You doing okay with this?
Mm-hmm.
Let me see if I can get there with the bigger one. So the person that figured out the best way to do this peel was a plastic surgeon, Dr. Heder, and it was in the year 2000 when he figured out that the way to make this work the best was using the higher strengths of croton oil. So the croton oil was the trick in terms of doing these phenol peels. That was what dictated how deep this peel goes. And by doing that, it allowed us to use less phenol, which is the scary part of a phenol peel, because the phenol, high percentages of phenol is what can cause the heart problems. And they used to use, the Baker Gordon was a 50% phenol. The ones that we used ever since Heder, it's called, Heder's formula kind of is 35%. So we're using a lot less of the phenol, so it is a safer way to do this peel. And it's been reported that when you do these small areas like this, you don't have to worry about monitoring the heart at all. It's just there's not as much phenol being applied to the skin that way, so much safer. This is awesome. That's a good sign. When you see these kind of brownish discolorations, that means I got that means I'm getting through there. I may want to do a little bit more here in the middle.
See, he's a perfectionist, and that's great.
Are you feeling much of this down on the chin? A little bit?
No, I know you're down there, but
Not so much.
it's amazing that I'm not feeling it.
Okay. It's just an intimidating thing to do. I'm doing a deep chemical peel, but it's just a Q-tip. There's no heat involved in this, so it's different from lasers and things. And that's the one thing that people don't like about that CO2 laser. Apparently, it's pretty painful. I guess there is somewhat of an art to this. You start to recognize because I know what it's supposed to look like. So I know what the end point is in terms of getting to the right depth, and I can change it based on what I see in the skin. So it's not like a laser where you dial it in and say, I'm going to do this depth all over. This is more of, I'm going to do a little bit here, more here, less here. So I can see there's still a little bit of pink showing through here. I'm going to do a little bit more here, a little bit more here. And it's a swiping motion, so you're getting, you're treating the entire surface of the skin. Sometimes these lasers are not hitting the exact, every single cell like this is going to do. On these creases here. Good. Do a little more on the other side. Just trying to make sure everything looks even. We're close to being done here. So that's what's different about this versus the lasers, that I can go in and just get little specific lines that are bothering me. Make sure I get those really good. Looks good. How's it feeling? Not much?
Really not much. It felt like you were applying a little pressure on my teeth, but there was no pain.
There's no pain?
Mm-hmm.
Okay. I got that pretty even there. This I didn't go out too far. Like I just did it's just mildly pink out there. The upper lip I crushed, so that should be really good. Let me do a little bit more underneath that lip, under the lower lip there. Because nothing looks better than when this tightens up and it pulls those lips back out. It looks so good.
And I had the little creases in the corner.
We'll see if, it's just swollen right now, so, so that looks better already, but that will go away. But when the peel causes that tightening, that's when it helps pull everything open. All right, good. We'll get a mirror just so you can see.
Oh my God.
Look how swollen it is, right? But I really went hard across here. See how this is almost kind of gray looking? Look, the difference is. So here, see how this is pink? So that was a light peel. Okay, and then we have the whitish color, and that's kind of that's medium. Deep enough. Yeah, that's deep enough.
Line right
okay,
there.
I'll do a little bit more. Turn towards me here. Get that. Okay. I just want to make sure I got that right. Okay. Yeah, I'll do a little bit more of the toothpick on that one area, and then it's always hard to tell how much the peel is going to do, but I think we did enough to kind of get you a good result there. All right. So basically, there's a cleanser and then something you apply. That's it. And I put 1s on the ones you start with, and then 2s on the ones that you go to after that. In this cup here, you take one of these little tablets in here and you just put it in here, and it'll turn into a towel. And then for your lips, you just used Aquaphor. Oh, this looks good. That upper lip, that gray color is perfect. That should work. That should get rid of those things.